people. I moved to Sioux Falls, South Dakota, population of 90,000. They had 2 MRs in that one town alone. While in Sioux Falls, in Winnipeg, 750,000 people, there were 2 CAT scanners that people had to wait for. 2 CAT scanners for all those people. Sioux Falls, South Dakota, population 90,000, had 4. During my time before radiology, working in the emergency room, and just part of my clinical training, people were admitted to the hospital through the hallways. The hallways were lined with stretchers. People waited for days to get a room in the hospital. Some people went straight from the hallway to surgery, and some people went straight from the hallway to home, never seeing a hospital bed. There were no beds, there were shortages, and if you were sick and had to be admitted, sometimes you got the hallway rather than a room. Some people we had to put 3, 4, or 5 blankets on in the wintertime to keep them warm in the wintertime because the cold air coming in through the doors. Sometimes we'd be in the emergency room, some family member would run into the emergency room saying there's a person sick in the hallway in a stretcher that a nurse never got to, and we'd have to run out and take care of those people. So this was all related to bed shortages and rationing of healthcare by the government. It's clear that we needed more hospitals and more hospital beds. After I left, talking with classmates who stayed behind, things got worse. Rather than building hospitals and building new hospital beds, the government actually closed hospitals and closed entire floors in hospitals. You ask yourself, why would they do that if there's a shortage? Well, if the government is paying for health care and you as a patient are going to occupy that hospital bed, you are going to generate a charge to the government. A good way to control cost is if that bed is not occupied, there is no charge to the government. So the government shut down hospital beds. In America, in Omaha, Methodist Hospital or Legion Hospital, if they want to support this community or better their hospital and better their patients, they can go out and buy a piece of equipment right now for the good of this community. In Canada, that's illegal. That's right, you heard me, it's illegal. You have to ask the government for a piece of equipment. The doctors have to lobby for it. The hospital board has to lobby for it. And if the government wants to and feels necessary, then you will get it when they see fit, not the physicians. There's a hospital in Winnipeg called Victoria Hospital. It's a community hospital, or pardon me, a suburban hospital in the big city, just like a Manual Hospital would be, or a Lakeside Hospital would be in Omaha. The only CAT scanners in Winnipeg were at the university hospitals downtown. Victoria Hospital did not have a CAT scanner. The doctors felt, and the hospital board felt, that they needed a CAT scanner to better serve their patients. They were refused by the government. The people took it upon themselves to raise money. They raised over $1 million to buy this piece of machinery. On the day that the ribbon cutting ceremony was supposed to take place, the government showed up with a construction crew and built a brick wall in front of the door. That brick wall stayed for almost a year, and that machine was unused. You ask yourself why this just doesn't make sense. After all, the people bought this machine, not the government. Well, the reason for this is, if that machine was in use, treating patients, then those patients and their doctors would be submitting bills to the government, and the government would have to pay for that. So this is a way of cutting costs. Just don't allow it. I want to share some personal examples with you now. Talk about unplugged